Esteemed members of the profession, good evening. Welcome to today's webinar. If you can hear me, please type on the chat. Let us know which branch you're joining us from. If you can hear me, please type on the chat. Please let us know your name and which branch you're joining us from. Right, thank you so much. Dr. Anthony Gitonga from Coast Branch. Dr. David from Nairobi branch. Karibu. Dr. Eric from Nyanza. Dr. Emily from Coast Branch. Karibuni. Dr. James Riungu from Nairobi. Karibu. Dr. Shelan from North Rift. Dr. Caleb from Turkana branch. Karibuni sana. Dr. Collins Jaguga from Nairobi. Dr. Anthony Yaile from South Rift. Dr. Shital from North Rift. Karibuni sana. Dr. Felix from Nairobi, Karibu. Dr. Kambuthu from Mary County, Karibu. So you also have Dr. Eugene Watila from North Rift, Karibuni sana. Dr. Grace from South Rift, Dr. John from Coast, Karibuni sana. Dr. Victor from Central Rift, Karibu. I'm glad to see that all branches are represented. Dr. Eric from Nairobi, Dr. Hilary Kagwa from Tana Adi branch, Karibuni sana. Dr. Mukone from Western, Karibu. Dr. Nora from Nyanza, Karibu. Dr. Tabitha Kabubo from Central, Karibu. All right, thank you so much. I think we'll get started. So welcome to today's webinar. I'll be a moderator for today. My name is Hezron Munyakin. And today's webinar will be focusing on self-care and family planning, how to counsel clients on DMPA-SC self-injection. So we have two main speakers, and that is Dr. Michael Mungoma, who's the Dean, MKU, School of Pharmacy, and also Helen Karoki from DKT International, and she is the Program and Business Development Manager there. So I'll briefly take you through the ground rules for this session. And first, it's to thank you for participating in this session. And I would like to let you know that you'll be muted during the entire course of this session. So if you have any questions, please use the Q&A tab, which is at the bottom of your window, and the questions will be addressed by the presenters at the end of the session. For all the members, kindly ensure that you subscribe on the PPB portal so that the CPD points will be awarded later on. And please note that this session is being recorded and it will be made available on the YouTube page. So for the program of this session, we'll start with the opening remarks from PSK, and then we'll have a presentation by Dr. Wanjiru Munene from inSupply, who will speak on an introduction to market test projects. And then we'll have a knowledge check test, which will be run by Dr. Johnson Anyona, Then we'll have a presentation by Dr. Michael Mungoma on self-care in family planning. And then thereafter, we'll have a presentation by Helen Karoki on family planning and self-care products. Then we'll have a post-test, which will be run again by Dr. Johnson Anyona. And then finally, we'll have a Q&A and then closing remarks. So at this point, I'd like to welcome Dr. Wanjiru Munene to give a presentation.
Great, thank you, Hezron. I think you have the slides with you, if
yes,
you
may. Just sharing shortly.
Great, thank you. So good evening, members. Good evening, colleagues. My name is Wanjiru Munene. I work for inSupply Health. I'm the Senior Advisor, Market Development and Partnerships. I'm also a member of PSK, registration number 2289. So thanks so much for making time to join us today for this webinar. We hope it will be insightful and expand knowledge on FP and specifically self-care. So I would like to introduce today just a quick brief on who inSupply is, and also just a quick brief on this particular project covering this, the reason why we are gathered today for this webinar. So next slide, kindly. inSupply Health is an East African advisory firm that is wholly owned and a subsidiary of JSI Research Training Institute, Inc. We pride ourselves in creating innovative approaches for improving health outcomes through strengthening health systems by providing resilient, sustainable, and scalable supply chains, both for private and public sector. So inSupply Health is registered both in Kenya and Tanzania. And some of the things that we consider a value add to our partners is that we have a global perspective localized. So our entire team is locally made up of Kenyans and Tanzanians, but we have a very great affiliation to JSI, both in Africa and other parts of the world, including the US. We consider empathy at the core for all our technical assistance and all our engagements through using human-centered design and user design experiences before we create any solutions. And we focus on co-creation as well with our partners and the end users. We also think about innovation as a process and not necessarily creation of products and technologies. So how are those products and technologies adopted by communities and end users? Again, for us, it's very important that we create highly quality contextualized and technology and enabled supply chain solutions, both for private and public sector. Next slide, please. So as I mentioned, we work both across private and public sectors, and we're doing different things. For public sector, I'd like to just emphasize that we are working with different healthcare cadres, including pharmacists in healthcare facilities and in administration, looking at fostering data visibility and analytics, and also ensuring a data use culture and quality improvement culture within supply chain systems and logistics management. For private sector, what I'd like to highlight is we facilitate market entry strategies and understanding to navigate how to improve innovations to be adopted in the market for local context. So one of the specific things that we are currently doing is this particular market test project, which is looking at market entry in the private sector for DMPA-SC. Next slide, Hezron. So just a quick snapshot on what market test is. We are aiming to strengthen and increase access of family planning through retail pharmacies in Kenya, and hence our active engagement with the society and with the fraternity of the pharmacists. Our main goal, next slide, is to look at how to develop and test viable, scalable pharmacy business models that offer client convenience, discreet, and quality counseling for family planning. We're also looking at self-injection of DMPA-SC as part of a larger basket of self-care, as we also facilitate the conversation around self-care. Market test as a project is currently running from 2021 to 2024. and it has 3 key objectives. Number one is that we aim to increase the number of women accessing quality family planning through the community pharmacy channel. 2, it's important for us to also document what are the value propositions for the pharmacists themselves to offer this DMPA-SC for self-injection and other self-care products within a self-care basket. And number 3, it's to expand the network of pharmacies implementing viable business models that offer quality counseling, training, and family planning products. So some of the things that are important for us also is training and this creation of awareness, and to make sure that including self-injectables as part of a self-care basket. So for the next slide, we'll show you some of the regions that we are currently implementing this particular project. We split it in about 3 clusters, but could say we are in about 8 counties. So cluster 1 encompasses Nairobi, Thika, Kiambu, Kitengela, Kikuyu, Narok, and Meru. And then we have cluster 2, which is Kisumu, Kericho, and Kisii. And cluster 3 covers Nakuru and Eldoret. So currently for this project, we've been working with about 30 pharmacies. And I said 8 counties, but correction there, it's 9 counties. And then what we are aiming to do with this project is at least cover 500 plus middle class women aged between 18 to 49. So that would be our target reach. And the solution scaling is we would also aim to add the counties that we are working on as a scale-up project and covering up to about 1,600 women in our scale-up phase. So with that, I would like to welcome you again to the webinar. Let's all participate. Let's actively ask questions. And I'm happy to answer any questions during the webinar. Thank you very much. And I hand it back to Ezra.
All right, thank you so much, Dr. Wanjiru. So next we'll have the pre-test that will be run by Dr. Johnson. Dr. Johnson, maybe you could share your screen.
All right, thank you, Hezron. Good evening, colleagues. Thank you all for joining our webinar today. My name is Dr. Johnson Anyona. I work for inSupply Health. I'm a supply chain advisor. And we have a very exciting and insightful webinar lined up for you today on the theme around self-care in family planning. So before we dive into the main presentation, we would just like to do a little knowledge check before and at the end to assess the level of knowledge of participants on today's topic. So as usual, we'll do this on Menti. So from wherever device you're dialing in, your phone, laptop, desktop, go to your web browser and type www.menti.com. Menti is M-E-N-T-I, menti.com. Once you're in, it will ask you for a code. The code is displayed at the top of the screen. As you can see, that is 22909117. So once you are in, you'll see a love button. Just press it so that I can confirm that we have people joining in. So we're doing a knowledge check for those joining before we get into the main presentation on Menti. So go to your web browser, www.menti.com. The URL is at the top of the screen. You can see it, and the code as well. Once you're logged in, key in that code that you can see at the top of your screen, and then press the love button to register your presence. I'll give us a minute and then we'll proceed. So we are doing a knowledge check. Those joining, we are doing a knowledge check before we get into the presentation, and it's on menti.com. Menti is MENTI.com. So on any browser that you have, just dial in menti.com and then type in the code that you are seeing at the top of your screen, 229091117. Once you're in, press the love button so that we can proceed. 20 seconds before we begin. Okay, let's get started. So the first question, what are some reasons why some women might not be interested in self-injection? What are some reasons why some women might not be interested in self-injection? Please type in your responses. Okay, let's move on to the next question. Thank you. I can see quite a number of responses. Lack of knowledge, pain, fear, fear of needles, phobia, stigma. Thank you, thank you. Right. Second question. Which of the following supplies is not necessary for self-injection counseling? Today we are talking about counseling. So which of the following supplies is not necessary for self-injection counseling? Okay, I can see majority have selected a syringe. We'll see at the end what the correct answer is. Next question. Which of the following is not an appropriate example of a household sharps disposal container? Which of the following is not an appropriate example of a household sharps disposal container? Excellent. I can see majority are saying I used DMPA-SC pouch. We'll see what the correct answer is. Next question. What are the 4 critical DMPA-SC injection steps? And here you're supposed to select the 4 that apply. Okay, thank you. Next question. What is the reinjection window for DMPA-SC? Excellent. Next question. I think this should be the last one. Which of the following is a situation in which your client should not reinject? Which of the following is a situation in which your client should not reinject? Okay, that should be the last pre-test question. Thank you all for taking part. If you struggled in any of the questions, you are definitely in the right place. And we hope that by the end of the webinar, you will be able to be competent and confident in all matters dealing with self-care and counseling clients on self-injection. Back to you, Hezron. Thank you.
Right. Thank you so much, Dr. Johnson. So next, we're going to move into the presentations, and we'll be starting with Dr. Michael Mungoma. Dr. Michael, if you can hear me.
Yes, Hezron, and a request to share I'll share my screen.
Okay. Just go ahead.
Okay, good evening, everybody, and welcome to another CPD session. Another session this evening. Welcome everyone who is joining in for the first time. This is part of a CPD continuous professional development, which is actually an ongoing lifelong learning that should essentially provide experiences which can help you develop and improve your pharmacy professional practice. The other objective, again, is just to build your strengths, look at some of the gaps that are there, and enable you to continue doing what? To continue being as competent as possible in whatever you do. So I'll just take you through. I'll take you through counseling of clients on DMPA-SC. That is a subcutaneous preparation. I'm trying to put these on full screen. Just give me a minute. Yes. So, as was introduced, my name is Dr. Michael Mungoma. I'm also the chair of the Education Committee of PSK. And from this session, what we want to do is to be able to explain self-care, the importance of self-injection, prepare for self-injection, train and counsel clients on self-injection, and be able to review key counseling messages for self-injectors and be able to conduct self-injection resupply visits. So I'll just start with a little bit of background on self-care, because this is a very, very important concept that is that we're expected to continue promoting and empowering our clients, because we are now moving to a point where people should be able to take care of themselves. WHO defines it as the ability of individuals, families, community to promote health. Yeah, to promote health, prevent disease, maintain health, cope with illness and disability with or without the support of a healthcare provider. But it doesn't necessarily mean that the healthcare provider becomes unimportant. It just strengthens, it emphasizes the fact that we are very key in ensuring that this happens. And whether it's for their experience of pregnancy and childbirth, managing fertility intentions, preventing STIs, enjoying better sexual health of themselves or their partner, or self-monitoring their BP, access to quality self-care interventions, again, can meet people's many health needs and rights. So in family planning, self-care is a natural fit for family planning. Refers to ability of individuals, families, communities to promote, maintain sexual health, prevent or space pregnancies. Let's remember again that family planning doesn't necessarily mean, it doesn't actually mean that you stop people from getting children. You just allow them to be able to space their pregnancy and plan appropriately with or without the support of a healthcare provider. So the WHO, again, self-care guidance features several recommendations for high-quality family planning services that include OTC access to EC pills without a prescription, which essentially means as the pharmacist, you should be able to have adequate knowledge and skills and the confidence to engage clients over EC pills, pregnancy self-testing, self-administration of injectable contraception that we're going to discuss, OTC contraceptive pills without a prescription, male and female condoms, and self-screening with ovulation predictor kits. Currently, Kenya is finalizing its guidelines, and these would be some of the focus areas: self-management, self-testing, and self-awareness. With self-management, it's self-medication, self-treatment, self-examination, self-injection, self-administration, self-use. Again, these are all geared towards empowering the client, ensuring that there's collective participation in the overall health and objectives when it comes to family planning. Self-testing, self-sampling, self-screening, self-diagnosis, collection, as well as monitoring, and self-awareness, self-help, self-education, that people need to be able to access information. Unlike previously, we need to be very, very efficient with technology and other sources or other channels of communications, including social media, because that is where the world is going. Self-regulation, self-efficacy, and self-determination. So counseling clients on self-injection, this is very important. One, because it can offer convenience and privacy, something that a lot of clients really value. Proper counseling and training helps ensure success. And here you need to underline proper counseling, because with counseling, it's not necessarily telling, it is engaging. It is engaging to the effect that both of you come to a common understanding, people are able to make informed decisions, and that the client can leave knowing exactly what she's supposed to do. Talk with your client to make sure self-injection is the right choice for her. So we should be able to think of a few reasons why some women might not be interested in self-injection. Yeah, because again, we all have our own reservations when it comes to injection. And that is something that we also need to be aware as the healthcare providers that could be in some of our clients. Anxiety and fear about finding a private place to inject. They probably, where they live or where they reside or where they work, they may not have the privacy to inject. Securing a place to store or dispose of units safely. Again, disposal can be a challenge. It needs to be discussed. Clients need to be assured that it is okay and that it doesn't have to be very expensive or very complicated when it comes to storage and disposal. Needles and injecting herself. Those are some of the fears. So some of the materials for the client include DMPA-SC self-injection, instruction job aid, which contains pictorials of what the client is meant to do in a very stepwise fashion that is easy to follow, and then a re-injection calendar to allow clients to be able to calculate and know when they're supposed to come back or when they're supposed to re-inject. So when it comes to the counseling, supplies for the counseling, client counseling, soap and water, DMPA-SC devices, an injection model, and it's all about being innovative so that clients also feel like it is not a very complicated process. Examples of household sharps, disposal containers, and then a waste basket. These are things that as the healthcare provider, you should be able to have at your disposal or create so that the client can actually see how this can work. So how to create an injection model? Fill a condom with salt, sugar, or cotton, as depicted in the diagram there. To fill with salt or sugar, wrap paper into a cone shape and insert into the top of the condom. So the purpose of this is to make these as practical as possible. Fill the condom at least 3/4 full with enough room to tie off the end. And then the model should be firm but still pliable so that it is easy to gently pinch a tent. And it's important to be able to pinch a tent because that is how the skin works. It should be able, the client should be able to pinch a tent for subcutaneous injection. So here, for the purpose of practice, ensure that it is not too, maybe too hard or impossible to pinch the tent. So training should be conducted on a one-on-one, ideally, so that there is concentration, you're able to look at the client, you're able to determine concentration times of the client and see whether they're engaging in other activities, looking at their phones, or even just getting lost. So, or with a small group, not more than 10 clients. Always have a place for private one-on-one counseling sessions with each client to discuss all available method options, confirm her choice and eligibility to use the DMPA-SC, and answer her questions. As regards storage of the DMPA, explain that this method should be stored in a safe place away from extreme heat or cold. and discuss home storage options such as a suitcase, a handbag. Make it very open for the client to think of her environment. Does she have carton where maybe people don't access? Does she have a certain container where she keeps maybe certain private documents? That could be an ideal place. Or a handbag that is out of reach of children, or a place that is actually lockable, or a high shelf that is not easily reachable. Remind your client not to open the package until she is ready to use. Very important, so that they don't go back home and for one reason or another decide, let me open it, I'm not going to use it anyway, and then leave it open, or even discard the package or the cover, which contains other essential information such as expiry and so on. Again, remind her, keep it away from others to prevent injury, including children. Give your client disposal instructions. One, to be able to discard device immediately after injection. And it's important here that it is immediate. One thing that could easily happen is that clients self-inject, maybe the first time at home, and then they are busy looking at the injection site, or they start daydreaming, or they start getting on their phones, and maybe they quickly get up from wherever they have done the injection and leave the Uniject, the syringe, on a surface, on the table or on the chair or on the sofa. So they need to discard it immediately after injection. Use a puncture-proof container with a lid. Store in a safe place away from children to avoid injuries or infection. Injuries that can come from piercing, scratching, or infection in the event that maybe she has an infection. Return used devices to a health worker as convenient. In our case, that they should be able to return these devices to the pharmacy, and that you have a mechanism or a system of further disposal, so that if this is discussed during the counseling, then even clients are not worried about, where do I take this? They actually know that they can come back to you, one for disposal, or even just to get information about if probably they didn't ask you during the counseling, that they have the confidence, they feel safe enough to come back to you. Okay. So the following are appropriate examples of household sharps disposal containers: a wide mouth soda bottle with a lid, used DMPA-SC pouch, petroleum jelly container with a lid, closed plastic bag, closed paper bag, single-use water bottle with a lid, or a narrow-necked bottle without a lid, so that it's not easy for it to come out. The following are appropriate examples of household sharps again. So the ones that are highlighted there are the most appropriate. Wide mouth soda bottle with a lid, petroleum jelly container with a lid, single-use water bottle with a lid. And it's important to pick on these ones because of with a lid. Yeah, we also don't want a situation where people are disposing these things in a plastic bag and then it pierces through the plastic bag. So ask your client about possible containers available to her. Make sure your client understands that used devices may contain germs that spread disease. Breaking down the language during the counseling so that both of you understand what germs are. A lot of the clients may not have medical background. However, with exposure to the world, technology, and what is going on, you should be able to describe what germs, bacteria, infection is about, and that they should be able to understand that if this is not handled properly, there's a possibility of infection. There's a possibility of creating another health concern because of accidents from the shops. So demonstrating the injection technique, use an injection model to demonstrate. Like we said in the case, filling up a condom with salt or sugar. Clients should follow along with the job aid during the demonstration so that they follow what you're doing and they look at the pictorials before them. Demonstrate each injection step in the self-injection job aid. This is important because these job aids are things that you're going to allow your client to go home with. So if health workers demonstrate this self-injection, client practice is not generally needed. However, if your client is struggling to understand the injection steps, you may want to give a chance to practice. And this would be even more ideal so that they can, no matter how intelligent they look, because there are also clients who look quite so intelligent that you feel you may not need to get her to demonstrate, but it's always good as part of teaching and learning to allow the learner to do some practice before you, because it instills confidence, it reduces chances of assumption, and ensures that the procedure is done correctly. So what are the 4 critical steps? First, we just go through the steps here, and then we'll see what are the 4 critical ones. Wash hands if possible. Open the pouch. Remember, self-injection is not a sterile procedure. Mix solution by shaking device for 30 seconds. Check device for leakage. Over and above, check the expiry date of this device, product. Activate device by closing the gap of the Uniject. Remove the needle cap. Pinch the skin gently to form a tent and insert needle. Slowly press the reservoir for 5 to 7 seconds to inject. Remove needle from injection site and then let go of the tent. Lastly, discard the device. So the 4 critical steps here are these ones that are highlighted. The first one being mix solution by shaking device for 30 seconds. That is so important because sometimes there's a bit of precipitation that occurs upon storage. And checking the device for leakage. So make sure that the device is shaken for 30 seconds, not 10 seconds. Activating the device by closing the gap. Because if you don't close the gap, there's a chance that the contraceptive is not going to leave the device and it's not going to get into the body. Those that are forcing it might even break it. Thirdly, third critical step is to pinch the skin gently to form a tent and insert the needle. It just really helps or complements with administration of the DMPA-SC, and then slowly press the reservoir for 5 to 7 seconds. This is important because it ensures that all the contraceptive gets into the body and that an adequate dose reaches the body to impart contraception. So the 4 critical injection steps: MAPS, that is the acronym that can help us remember. MAPS, M for mix, A for activate, P for pinch, and S for slowly. So just to determine and confirm competency, encourage her to use the job aid for clients, allow her to inject herself, providing coaching as needed, confirm her injection competency, focusing on the 4 critical steps that we mentioned up there, the maps. Ask if she has questions or concerns. This last one is very, very important, that even after they have demonstrated, because sometimes clients can follow silently. Yeah, and part of even just being silent is being able to demonstrate silently. You should be able to now allow her to ask questions and provide concerns. Clients need to be able to calculate reinjection dates on their own because it enables them to be independent. It allows them to be independent. They don't have to come to you again to ask you when the reinjection dates are. As part of coaching, as part of the training, include the reinjection dates. They will know what to do if the injection date changes. So you'll have a calendar there, and ideally it should just be 3 months. So 19th March, 19th June. And that you should also allow the client to know up to when they're still okay to reinject. So the reinjection window, certain key points, a client is within the reinjection window if she's up to 2 weeks before or 4 weeks after a scheduled reinjection date. However, encourage the client to reinject on the date that she is scheduled. Practice finding the window with your client so that they understand what is 2 weeks or 4 weeks. Remind client that it is okay if she's a few days late for reinjection, because again, there could be circumstances that contribute towards lateness. It could be that on the day of reinjection, she might have traveled a few days before, or they could have even moved house or made a few changes in the house. She should still reinject if she's within the reinjection window, even if it is not her exact reinjection date. Make sure she knows when she needs to recalculate any future reinjection dates. So rescheduling reinjections, make sure your client correctly calculates her actual reinjection dates. She should calculate the reinjection dates to match the number of devices she will take home. Once you gain confidence on the client, then they should be able to, as part of self-care, be able to take a few doses to self-inject. So even as we go through, what suggestions can you think of to help your client remember her reinjection dates? Because again, you also need to think about your context. You also need to think about the sort of clients that come to your practice, that come to your pharmacy. Suggestion to help your client remember is refer to the calendar she receives from you, marked with dates, or they can come with their own calendars, or even they can use phones, because we all now have smartphones. So they could even just do it there as you go through the coaching and the training. Cross off each week of the calendar. Note whether reinjection dates are close to a holiday, market day, child vaccination dates, and other events that could allow her to remember. It also means that you're engaging that client. And when you engage a client at that level, so they can even remember what is happening or what is going to happen on specific dates, then they're likely to remember. And they're also likely to appreciate and remember that session that they had with you. Ask a friend, partner, or family member to help her remember. If they came with a friend, or a partner, or a family member, put a reminder on her phone if she has one with that capability. So that again, you're not pressurizing clients to have smartphones. Using a client menstrual cycle is not a good strategy for remembering reinjection dates. So the calendar is the best. So when not to reinject, one of them is if she's recovering from a flu, she's 1 week early, she's 7 days late for injection. If she's more than 4 weeks late for her injection, she does not remember the date of her last injection. Situations where a client should not self-inject: if she's more than 4 weeks late for her injection, if she does not remember the date of her last injection. Those two are situations where clients should not self-inject. More than 4 weeks late, if she does not remember the date of her last injection, so that you don't get, or you don't engage in a guessing game. And that you also tell her not to engage in a guesswork game. So in these cases, your client should use condoms and abstain from sex to avoid an intended pregnancy until she speaks with a health worker who can evaluate her for pregnancy. So meaning also you need, as part of counseling capability, to have referral systems. Somebody who works in the pharmacist, you should be able to know a clinic, a hospital, to be able to refer if they need further evaluation for pregnancy. So before your client leaves, ask if she has questions. Discuss her options for follow-up. Discuss her options for follow-up. Does she need to come back? Does she feel she needs to come back? Can you guys just talk over the phone? Can you guys have video conversations, texting? Check expiry dates for all DMPA-SC pouches you give her to take home, so that you don't want to get into a situation where things are in debt. However, you've given probably 3, and those 3 will keep going for the next 9 months. And probably by the time they get to the 9th month, maybe one of them has actually expired probably by month 7. Give her DMPA-SC devices for self-injection. Explain that unused DMPA-SC should be returned to you or a health facility, not given or sold to others. Remember again that as part of self-care, we are saying one of the objectives or one of the intention is self-determination. With self-determination, what that means is that clients are able to make informed decisions when they want to become pregnant. And sometimes they may not be able even to come and tell you that now I've decided I'm not going to self-inject. They probably have made that decision and just say it silently. Okay, yes, I have. I was given, well, I decided to take 3. I was given maybe 3 doses. But at the end of the 2nd dose, they say, well, I've changed my mind. We have changed our mind together with my partner. Now we are going to stop this and we're going to try and get a baby. Unused DMPA-SC should be returned to you or a health facility, and that it should not be given to another person, because that is just human behavior. They could easily say, give it to another neighbor or give it to someone or sell. That should not happen, and that should be included in the part of counseling. So the client self-injection package, we are saying here, it would include the self-injection instructions or the job aid. 2, re-injection calendar in whatever form, a physical one that you've printed. It could even be branded for your facility, so that it's, again, part promotion. And then DMPA-SC pouches that contain the DMPA-SC. So when it comes to resupply and follow-up, ask if she has questions. Confirm her re-injection date. Confirm how she stored and disposed devices. Receive and dispose of her used devices, including the ones that are unused for whatever reason. Ask if she had problems re-injecting. Ask that question. Did you have problems re-injecting? Because they could have just gone silent, or they could have re-injected with problems. review 4 critical injection steps, just to ensure that that knowledge, that competency is still there. Confirm that she wishes to continue contraception, DMPA-SC and self-injection, or does she want to maybe switch methods? Confirm her eligibility to continue DMPA-SC. Support her with rejection date scheduling and provide supplies for next injections. So demonstration and return demonstration. The goal is practice self-injection demonstration and counseling in pairs. And these are just some of the resources that are out there about DMPA-SC self-injection, which I'm going to share in the chat box for us to maybe view and appreciate the practicalities of DMPA self-injection. Thank you.
Right. Thank you so much, Dr. Mungoma, for sharing those insights. So are we going to play the video? We're just going to share the link on the chat.
I think for purposes of time and
Okay.
the way you scheduled, we may not have the chance because we also have another presentation, and then yes, but I'll just share it in the chat for everyone.
Okay, all right. Thank you. Thank you for the clarification. So next, you're going to have the next presenter from DKT, Helen Karoki. Helen, can you hear me?
Yes, I can.
Okay.
Hi, everyone. Hezron, would you please share my slides?
Yes, yes.
Okay, fantastic.
All right, you can go ahead.
Yeah. Okay. Good evening, everyone. My name is Helen Karoki. I'm the head of programs and business development at DKT East Africa. I'll quickly take you through DKT International Kenya's family planning and self-care products. Next slide, please. So a quick introduction of who DKT International is. We are a global organization with over 3 decades of experience in social marketing of family planning, HIV prevention, and reproductive health products. And we are the world's largest private providers of family planning, HIV prevention, and safe abortion products and services. We mainly work to increase the availability and affordability of the modern family planning methods across the globe. Number 2, we strengthen the supply chain to increase availability of contraception and to improve the method mix variety. And lastly, we try and create demand and inspire new contraceptive users through campaigns, through billboards, advertising, IC materials, and all. So globally, I said we are 30 years old. However, DKT established its business operations in Kenya and Uganda in 2017. So we are around 5 years old, 5-6 years old in Kenya. Next slide. So our global presence is, as you can see in the orange coded countries, we have a physical presence with offices in 24 countries globally. However, the countries served by DKT through a regional office are 90 countries. And regional means, for example, Kenya is the headquarter for East Africa, and East Africa covers Uganda, Tanzania, Zambia, Zanzibar, and South Sudan. Yeah, next slide. So our 2022 global DKT sales, just to give you a feel of our impact globally, those are the numbers. I'll not go through each of them, but maybe on injectable contraceptive, we sold around 25.6 million 3-month injectable contraceptives. But as you can see through the other data, we are a huge organization in terms of family planning and reproductive health commodities distribution. Next. So our Kenya sales, and again, I'll just concentrate on the on the 3 months injectable contraceptive. We sold around 500,000 3-month injectable contraceptive last year, and it looks like a low number, but it's not. We just introduced the 3 months injectable contraceptive last year. So we are hoping to see bigger numbers this year and coming years. Next slide, please. So DKT Kenya's self-care products include DMPA-SC, contraceptive injection, and then we have 2 care products. One is called Macare, and Macare is a combination of 1 mifepristone tablet of 200 micrograms and 4 misoprostol tablets of 200 micrograms. And then we have misoprostol only tablets, which are 12 pills of 200 micrograms each. So for DMPA, I will try and not belabor what Dr. Mungoma has taken us through, but yeah, we have a DMPA-SC, although it's currently out of stock, if I may mention that. So it's a pre-filled and ready to inject injectable, and why it's preferable is because it has a lower dose than DMPA-IM. This one has 104 milligrams vis-a-vis the DMPA-IM, which has 150 milligrams. It's easy to use, it's stable at room temperature, it has 3-year shelf life, and it's preferable for self-injection than for women to help uptake of family planning commodities and increase acceptability. Next slide, please. So just an overview of the specifications. So I said the formulation is 104 milligrams of DMPA in a Uniject prefilled syringe technology. And of course, Dr. Mungoma already said it's injected subcutaneously by a healthcare provider every 13 weeks. It's convenient and safe. It's effective and discreet, and only requires follow-up every 3 months. Hence, very good for a woman, especially those women who are not able to uptake family planning because of their spouse or their spouses have a problem with them. So it's discreet. It's 99% effective at preventing unintended pregnancy when given correctly. And yeah, it has more acceptability. So just before I move to the next slide, DKT has been supplying DMPA-SC. However, currently we do not have stock through our distributors, but in case a provider or an organization would like us to maybe supply in probably large quantities, we are happy to do that. Next slide. Next. Yeah. So our second self-care product is MisoCare, which is misoprostol only. It contains 12 tablets of 200 micrograms each. And this misoprostol is used for a wide range of obstetric and gynecological and medical conditions. And it's approved by WHO in management of these conditions, which I'll say in the next slide. Next slide, please. So these are the indications and dosages for the MisoCare. And for self-care, clients can use it for post-abortion care or induction of medical abortion. And those are the doses. I won't go through each dosage, but the dosage for the self-care for medical abortion or post-abortion care is 800 micrograms starch repeated after every 3 hours, up to a maximum of 3 dosages. However, these misoprostol only drugs have several indications that are used in the maternity department by the obstetricians, with all those other indications stated there, and the dosages are also stated there, so I'll not go through each of them. Next slide, please. So just a quick overview of the MisoCare used for uterine evacuation, self-administration. If a woman is conducting a safe medical abortion or post-abortion care at home or by herself, this is how a healthcare provider should advise her to do it. The step 1, the dosage is 4 tablets of 200 micrograms, misoprostol tablets. Those are a total of 800 micrograms. And the woman should put the tablets under the tongue sublingually, keep them for 30 minutes, and then swallow the remnants with water. Then she should wait for 3 hours, And after 3 hours, she should do the step 2 of a repeat of the step 1. That's for tablets of 200 micrograms under the tongue, and keep the tablets for 30 minutes and swallow the remnants with water. Should the procedure not be completed, or she has remaining POCs, she should do the 3rd step of 4 tablets of misoprostol, keep them under the tongue for 30 minutes and swallow the remnants with water. However, should that not complete the procedure, she should go to a healthcare provider. You should refer her to a healthcare provider for further evaluation and to rule out things like ectopic pregnancy and other warning signs. Next slide, please. Then our 3rd self-care product is Marcare, and Marcare is a combination of mifepristone and misoprostol. It has currently just been introduced to the Ministry of Health and is being procured. And for use, it's used in post-abortion care and uterine evacuation. It is the World Health Organization recommended regimen for complete uterine evacuation without invasive surgical procedure, and has a higher efficacy than using misoprostol only. It contains 1 tablet of mifepristone, which is 200 milligrams, and 4 tablets of misoprostol, which is 200 micrograms. The WHO calls it the gold standard for uterine evacuation. Next slide. So for self-administration, if a woman is, if the healthcare provider is detailing to a woman how to use it at home, it can only be used, it can be used for miscarriage, post-abortion care, or medical abortion for a pregnancy with gestation up to 9 weeks, not more than 9 weeks. DKT's combi pack is registered for use up to 9 weeks. So again, when advising a woman how to take the pack, so the woman, the first step is to take 1 tablet of mifepristone, 200 milligrams, and should be swallowed with water. Then she should wait for at least 24 hours, but not more than 48 hours. And take 4 tablets of misoprostol sublingually, hold the tablets again for 30 minutes under the tongue, and then swallow the remnants with water. That should be effective in the total uterine evacuation. Should it not be completed, we do not recommend for additional tablets unless until the client is evaluated by a healthcare provider to rule out maybe the gestation, to rule out ectopic pregnancy, to rule out any other issue that could be preventing the drug from not being as effective. So next slide, please. Okay, so those are the 3 self-care products that DKT has, but beyond that, DKT has a full product portfolio of family planning method mix, and we have 3 brands. So we have Lydia brand. Lydia brand is our brand for family planning products, and under Lydia we have IUDs, we have emergency contraceptive known as Lydia Post Pill 2. We have an oral contraceptive. This is a combined oral contraceptive called Lydia Desolon. Lydia Desolon is in the class of Yasmin. It's a 3rd generation oral contraceptive pill, and we're marketing it for women who have mostly hormonal imbalances, and women are preferring it because it has additional dermatological benefits, and it has all the benefits that come with Yasmin. So it's a 3rd generation at a cost-effective price. And then under Lydia, we finally have the DMPA-IM injectable. I said we are out of stock with DMPA-SC. Then we have the 2nd brand called Care. Care is our brand for maternal and reproductive health care. And under that, we have the Marcare that I've just talked about. We have the MesoCare, and then we have the MVE kit. And then the last brand is Kiss, and under Kiss, we have the Kiss condoms. And then we have other 2 products that we do not have, they're not under any brand. So we have the Levoplant implant, which is a 2-rod implant for 3 years. And then we have a hormonal IUD, which is new, called Elera. And then we have the DMPA-SC. Next slide. So we have more reproductive health products coming soon. We have a lubricating gel, which we are dubbing it Kiss lubricating gel. And then we have a new brand of Kiss condoms, which will be coming soon, called Kiss Extra Time. So expect to see that in a pharmacy near you, or please ask for it from our distributors, but we'll let you know. We'll do a communication once they get to the country. Next slide. Should you want to inquire about any of our products in your region, you can take a screenshot or a photo of this slide. These are our medical representatives, and they're based in different locations across the country. So if you'd like to access any of the products that I've talked about, inquire about the price, inquire about where you can get any of the products, please check the location of where the MedRep near you is located, and you can probably call them. They'll be able to assist you pronto. Next slide, please. Meanwhile, should you be in contact with that distributor, any of the distributors, these are the distributors where DKT has all those products. You can also take a photo or a screenshot of these. You can reach out to any of these distributors and request for any of the products that I've talked about. But I've put a disclaimer that we are currently out of stock for the DMPA-SC. Next slide, please. Yeah. In case of any questions, feel free to ask through the chat or during the question and answer session. Thank you very much.
Yeah, thank you. And maybe Hezron, before we move on to the Menti session, we could actually play one of the videos there, maybe the last one. I think some of the questions are related to, if we could actually play the last on the list there, the last one is not too long, so that members can appreciate how the DMPA-SC is administered. So I don't know whether you can do that or.
Yeah, just a moment. I'm trying to.
I can do it, Hezron. Let me help.
Oh, okay, thank you.
Yeah, the last one.
Yeah. So let me know once you can see it.
Yes, we can. Yes.
Yeah, good, and we can hear.
Welcome. You have chosen to use subcutaneous DMPA or DMPA-SC. In this video, you will learn how to give yourself the injection. You may have received an instruction sheet that can help you inject on your own. Be sure to review this and keep it on hand. DMPA-SC is delivered in this small device. One injection will protect against pregnancy for 3 months. Store the device in a safe place away from children or animals and extreme heat or cold. The device has 4 main parts: the reservoir, which contains the drug, the port, a small needle, and a needle cap. To begin, wash your hands using soap and water. Then open the pouch and remove the device. Make sure it is not damaged or bent. You should also check the expiry date. Now, holding the device by the port, shake it for about 30 seconds until the liquid solution is mixed. If you do not inject right away, be sure to shake and mix again before you do inject. Check again to ensure there is no damage or leaking. If the device is damaged or the solution is not mixed, discard it and use a new one. Now you're ready to activate the device so the liquid can come out. Hold the device by the port while pointing the needle up to prevent dripping. Then, push the needle cap into the port to close the gap. Now you're ready to inject. Remove the needle cap. You can inject either in the front of your thigh or your stomach, avoiding the navel or any bony areas. With one hand, gently pinch your skin together and create a tent. With your other hand, hold the device by the port and insert the needle straight down into the tent. The port should touch the skin completely. That means the needle is inserted at the correct depth. Squeeze or press the reservoir slowly for about 7 seconds so most of the liquid comes out. It's okay if there is a small amount of liquid left. Remove the needle, then let go of the skin. Do not rub the injection site. Place the device in a puncture-proof container right away, close it, and store it in a safe location. At your convenience, bring the container to a facility or health worker so the devices can be disposed of safely. Now, let's review the most important steps for self-injection. Shake the device for 30 seconds. Activate the device. Pinch your skin to create a tent. Squeeze the reservoir slowly for 7 seconds. Remember, each injection provides 3 months of protection from pregnancy. Make a note to remind yourself of the next injection in 3 months. Now, there's some additional information you should know. You're protected against pregnancy when you inject within 2 weeks before or 4 weeks after your scheduled injection date. If you don't inject on your scheduled date, mark the date when you actually gave yourself the injection. Then count ahead 3 months from your actual injection date. This date is now your next injection date. If you're more than 4 weeks after your scheduled injection date, you may not be protected from pregnancy. In this case, do not give yourself the injection. Contact a health worker to discuss your family planning options. To avoid pregnancy, use condoms or do not have sex until you speak with a health worker. When using DMPA-SC, you might experience lack of monthly bleeding, heavy or irregular monthly bleeding, minor headaches, changes in mood or interest in sex, weight gain, abdominal pain or cramps. These are not usually something to worry about, but if you're concerned, contact a health worker. Also, remember that injectable contraceptives do not protect against sexually transmitted infections like HIV. Always use condoms in addition to the injection to prevent sexually transmitted infections. Contact a health worker if you have questions about side effects, prefer to have a health worker give your injection, or if you want to use a different contraceptive method.
Thank you, Hezron.
All right, thank you so much, Dr. Johnson, for that. So I think now we'll move on to the post-test. Maybe you could just share your screen again. Then thereafter, we'll have the Q&A session.
Okay, thank you, Hezron.
Welcome.
Great. So we'll do now a post-test to check the knowledge acquisition following the presentation. So you will once more go to menti.com. The code is at the top of the screen. I hope you can see it. So please log in and you'll get the love button. You can just press it so that we can register your presence for the post-test. Here is your chance to prove to yourself that you've actually gained some knowledge in this webinar. So we are doing this post-test on Menti. Menti is menti.com. You can access it in any of your devices, phone, laptop, desktop. And the code, once you're logged in, you'll see it will ask you for a code. Key in the code that you're seeing at the top of the screen, and then press the love button. Okay, let's go to the questions. So we'd like to hear from you what some reasons you think some women might not be interested in self-injection. What are some reasons why some women might not be interested in self-injection? Thank you for the responses. Let's go to the next question. Which of the following supplies is not necessary for self-injection counseling? We have the job aid, syringe, re-injection calendar, the device or dose of DMPA-SC, and examples of household disposal containers for the sharps. So which one is not necessary when you're doing counseling for self-injection? Okay, so let's see the correct answer. So if you chose syringe, that is the correct answer. Remember, this is DMPA-SC and not DMPA-IM. So you don't need a syringe for DMPA-SC, as it is a Uniject device that has everything in one. You have the medication and the needle in one Uniject device. Okay. So which of the following is not an appropriate example of a household sharps disposal container? Which one is not an appropriate example of a household sharps disposal container? A wide mouth soda bottle with a lid, a single-use water bottle with a lid, a petroleum jelly container with a lid, for example, a Remis, very good, or a used DMPA-SC pouch. So let's look at the answer. Yeah, so it's the used DMPA-SC pouch. Remember, the pouch is not puncture-proof. All the rest are. So you cannot store the waste, the sharps in the pouch, as it might lead to needle prick injuries. All right. Next, what are the 4 critical DMPA-SC injection steps? We've just seen the video. I'm expecting everyone to pick correctly the 4 important steps. There are many steps, but there are 4 which are really, really important for a client to master so that they are deemed competent to self-inject. And Dr. Mungoma gave us a nice acronym to remember them with. So let's take a look. Remember the acronym MAPS. So mix for 30 seconds, activate the device by closing the gap, pinch the skin gently to form a tent, and then squeeze the reservoir slowly for 5 to 7 seconds to inject. MAPS, mix, activate, pinch, squeeze slowly. Great. So now this one talks about the reinjection window. We also saw it in the video just now. What is the reinjection window for DMPA-SC? When is it safe to reinject DMPA-SC? Definitely, it is the first one, up to 2 weeks before or 4 weeks after the scheduled date. But remember, as was mentioned, we have to emphasize the adherence or the importance of adhering to the scheduled date. However, we know that it is safe to reinject 2 weeks before or 4 weeks after that scheduled date. Right. The last question. Which of the following is a situation in which your client should not re-inject? Recovering from a flu, 1 week early, does not remember the date of her last injection, 7 days late. Excellent. So if you remember from Dr. Mungoma's presentation, there were 2 scenarios where it is not safe to re-inject. The first one is if you don't remember the date of your last injection, or if it is after 4 weeks from when you are actually scheduled. So the correct option here is if you do not remember the date of your last injection. And that brings us to the end of our pretest, and I can definitely say that there has been a lot of more numbers of people who got the correct answers. So I'm happy that there has been knowledge transferred during this webinar. Thank you all so much for participating. Back to you, Hezron.
All right, thank you so much, Dr. Johnson, for running that post-test. So we're now moving on to the Q&A session. And I see we have a couple of questions that have been asked. Some have been answered here on the Q&A tab, but then I'm just going to ask some of them. So the first one is on about the expiry date. If the expiry date of DMPA-SC is a few days away, is it still okay to inject, or should it be returned for another dose? So maybe Dr. Mungoma, you could respond on that.
Thank you. So the expiry date should not be a worry. As long as it is still within the expiry, it is okay to inject. It's a very straightforward question. Some people ask that question all the time, but yeah, it is within the expiry. It is fine. All right.
Thank you so much. And then we have another question from Dr. Alex, who asks, which are the best injection sites? And if you could kindly mention a few expected side effects and how to counter them.
Oh, that's me again. So yeah, so yes, there are side effects associated with DMPA-SC or DMPA that people need to inform clients about. Weight gain, menstrual changes, they could be spotting, they could be increased, maybe heavy bleeding or light menstrual bleeding. Headache and dizziness or heaviness, lightheadedness could be another one. Acne or abdominal bloating. Some people may report reduced libido. But again, even as you counsel your client, it is important just to mention that these are side effects that are going to wear off, because remember, you're introducing one, a drug, two, a hormonal substance in the body that may take a while for the body now just to adjust to. So this is something that comes into the counseling process so that clients are aware. But again, it is to inform them that these may be temporary. However, if these get worse, they should come back. Thank you.
All right, thank you so much. There's also a question from Yes.
There was that question of the sites. Yeah. So as you saw from the video, the recommended sites for self-injecting DMPA-SC. Remember, it's subcutaneous, so it's under the skin. So the outer part of the arm, the fat of the abdomen, the upper part of the thigh. So those are the three recommended sites. So for self-injection, particularly, the most comfortable for clients is usually the fat of the abdomen and the upper part of the thigh.
All right, thank you so much for that, Dr. Johnson. And then we have a question from Dr. Chris. How do you assist a patient experiencing persistent bleeding as a result of using this family planning method, especially during her period?
So ibuprofen is recommended. Ibuprofen, even up to 800 milligrams 3 times a day for up to 5 to 7 days is recommended. That should be able to control the bleeding that is associated with DMPA-SC. Clients should be advised not to take aspirin. People ask about why ibuprofen. Ibuprofen, if we remember a bit of the pharmacology, it inhibits prostaglandins. So prostaglandins are associated with bleeding. They're associated with prostaglandins associated with inflammation that can worsen bleeding, especially during even menstruation. So they should be able to resolve the bleeding or what they express, because again, it's what the client is saying by taking ibuprofen, and then things should be able to continue as normal. Back to you.
Thank you so much for that. The next one is by Dr. Nilish, who asks, which day of the menstrual cycle is it advisable to initially inject?
So the guidelines recommend that injection should be done within the first 7 days of the menstrual cycle. And they also add that if in the event you inject DMPA-SC past the 7 days, especially during that period when the woman is most fertile, it is advised that you use a condom, a barrier method, during the first 7 days within that period. So ideally, first 7 days of the menstrual cycle.
Okay, thank you. Then we have there's a question on are there cervical changes? Are cervical changes part of the expected adverse drug reaction?
That's not a very clear question, because we don't know what cervical changes are about. But of course, now the mechanism of action, maybe that's what they're trying to point out. Increasing mucus to prevent sperm and so on. But I think maybe the question is not very clear whether that's an adverse effect or not. However, DMPA-SC is safe. and it's not associated with any adverse cervical changes. Yeah.
Okay, then there's a question on is it safe during lactational period, or does it interfere with the milk production? Maybe Dr. Anyona or Dr. Mungoma?
Okay, so one thing again is that when we are introducing contraception, we need to engage clients and look for the best methods, so that we don't want to say that you're lactating and so on, take this. No, we need to engage clients. Usually, there's contraception that is normally imparted once upon delivery, and that there are pills that are normally recommended to be taken by mothers who have just given birth, which is something again that needs to be discussed with the client. Dr. Nyona just posted something, 6 weeks postpartum is recommended for injectables. Yes. But again, when we are educating, sometimes it's important to ensure that people don't take things and then go and paste. Counseling here is the main thing. What is the client thinking? What are the circumstances of the client? Is the partner involved in this discussion? What sort of options are there? Is the mother exclusively breastfeeding? Is the mother planning to stop breastfeeding, so that you can engage on an appropriate method? For me, that would be the best answer, instead of saying DMPA-SC is good and so on and so forth. Thank you, Dr. Hezron. And remember, again, we have tools that can assist in this counseling process. We have the MEC wheel, and I think we've had a session where we've discussed the MEC wheel. And the emphasis here is to provide a service rather than a product. And so the focus here is good pharmacy practice rather than sales. Back to you, Dr. Hezron.
Right, thank you so much, Dr. Mungoma. And I think the other questions that were being asked a lot is on where they could, where our members could get the DMPA-SC. And I think Dr. Wanjiru has responded to that. For Nakuru, they could contact Kasha, Nila, and other major distributors that have also been shared by DKT. In Kericho, same. It's currently available at Kasha, and the number has also been placed over there on where you can make your order. And also DKT had also covered the same. So I don't know if there are any other questions that I've missed out on, Dr. Johnson or Dr. Mungoma.
No, I think we are okay. Maybe Helen can share again her details, because I think there will also be about where they can access some of these products. And I know she said that the DMPA-SC is out of stock. However, it would be important just to get the contacts and ensure that once they are in stock, then we stock up. Somebody's asking about teens age group. I think that is maybe a different discussion. Yes, it's important that we continue having discussions around sexual reproductive health rights among adolescents, which I think is something that is becoming more and more important, that adolescents are becoming more and more sexually active. Number two, they're able to make informed choices and informed decisions. And therefore, discussions around contraceptive methods need to be extended to them from our pharmacies, providing again a very friendly environment and being very empathetic of this age group, taking into consideration that we also have a legal environment where some of these adolescents are still considered children legally in this country. However, there are also those that probably get pregnant or even have children and therefore require family planning services, including providing contraceptive choices or contraceptive methods where appropriate. Dr. Hezron.
Right, thank you so much. I think I'll welcome Helen to just maybe go through again some of the locations where they can find those products. Helen?
Okay, thanks, Dr. Hezron. Please, would you share my screen on the last, my presentation, the last slide on distributors?
This one?
No, there, dedicated distributors. Yeah. So you can, please members, you can take a screenshot or a photo of these distributors. They are distributors for all over the country, and I will not read word for word each of them, but please feel free to take a photo of these or a screenshot. But majorly, most of our products are from Sagifam and Nila, and I think currently, Nila, Sagifam, our biggest customers, distributors. However, our MedReps can also help you in accessing these distributors, or if it's a product that you're not able to get, you can ask any of our MedReps, and that's, thank you, Hezron. That on your screen is a list of our MedReps in your current regions. So please also take a screenshot of that. All right, and then probably the very last slide. No, or the next one, Hezron, the next one, sorry, the next one.
This one?
Yes, at the bottom, there's an email. I'm not sure if they'll be able to see orders at the bottom of this slide. There's an email, orders@dkthealthcare.org. I don't know why I can't. Can you see it from your end?
Not really.
Okay, let's go to the last slide.
Okay.
The very last one. There.
Yes.
In case anyone has inquiries on any orders, or you have a feedback on any of our products, or you're not able to reach a MedReps or a distributor, you can write out to us through this email address on your screen, admin@dktinternational.org. There's somebody who asked about the prices of our products. I'm not able to give a concrete price list now because each distributor put a markup for themselves. So different distributors have different prices. It will not have significant difference. It's probably a plus 5-10 shillings price. So we currently don't normally share like a concrete price list because what you share is probably not what you'll get from your distributor. Yeah, thank you. Back to you.
Okay, thank you so much. I think we've come to the end of the session, and I'd just like to give a chance to our speakers for today to just give a parting shot. Maybe we could start with Dr. Wanjiru. Or Dr. Johnson, maybe you could start.
Thank you so much, Hezron and PSK, for running this. No, I was saying thank you so much to PSK for running this and for educating our members, and thanks for the members who joined. Thank you.
Okay, thank you, Dr. Wanjiru. Dr. Johnson.
Big thank you for everyone for joining and the engaging questions. The speakers for hosting this and taking the time to prepare an excellent presentation. Mine is just to urge and rally the pharmacists, especially those practicing in community. This is a space that you must take up. And we have a very pivotal role to play in supporting clients who are accessing family planning, and particularly self-care and self-injection. So emphasis on the counseling bit. So let's use this knowledge, skills that are available through this webinar series to self-improve and learn the best practices to offer the best care for our clients, as we are the first point of contact that most of our community members come to for medical advice. So thank you and lovely evening to everyone.
All right, thank you so much, Dr. Johnson. Next, we have Helen. Helen, do you have any parting shots?
Yeah. On behalf of DKT International, I'd like to thank you, every participant who has attended. We really appreciate your loyalty to our products. We hope that you're able to access in all of our products when you need them. I thank you to inSupply for the opportunity, and to everybody, and Dr. Mungoma for your presentation. Everyone who made this a success, thank you. From DKT, we are grateful, and good evening.
All right, thank you so much, Helen. Dr. Mungoma?
Yes, I think for me, it's just to appreciate our partners inSupply for supporting this through the market test project, and also all the participants showing up and remaining consistent in continuous professional development. We are hoping that this impacts positively in your practice, in your knowledge, in your ability, and your confidence in engaging clients on matters family planning. Again, we also just want to appreciate DKT for being part of this process and also supporting us in other areas, and also just to appreciate you, Dr. Hezron, for handling this so professionally and so well. Thank you.
Right, thank you so much, Dr. Mungoma. So at this point, I'd like to invite our Honorable Treasurer at the Pharmaceutical Society of Kenya, Dr. Angeline Ochoka, who's going to give closing remarks for this session. Dr. Angeline.
Good evening, everyone. It is such an honor to just be among fellow colleagues like this, and just to listen to amazing conversations that are going to change the landscape for the society, for practice, for everything that we intend to do. I'm glad that this is part of the strategic pillars that we've been sharing from a PSK perspective from the national level. And we are working with partners. And at this point, I'd just like to say a big, huge thank you to inSupply for consistently supporting us, for consistently just, working with us, wanting to better the profession with us, and just, thank you. I don't know if I can say that enough. So here, Dr. Monene, Dr. Anyona, Joyce Owola, asanteni sana. We don't take it for granted for having partners with you on board. I'd also like to thank DKT, Helen, just for being with us and for sponsoring and coming and having these open conversations about family planning. I think we are not where we were 10 years ago. Where we are right now is leaps and bounds, and it's due to partners like you who bring in products into this territory, into this market, that we continue learning and progressing more. And also just opening the scope for us to be able to also be involved in the use of family planning to the end user, that is the patient. So finally, members, I'd like to officially invite you to our AGM that is going to be held. Okay, communication has been sent out to all the various groups and all the various platforms. So please, 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 please remember to join us. Don't forget. Hezron, you'll put down the dates on the chat so that people are aware and so that they don't miss. We are going to be at the Aga Khan Sports Club. Finally, Dr. Mungoma, asante sana for just coordinating this whole session today, for just allowing PSK and the Education Committee to be able to do this on behalf of its members. So thank you very much. And Bwana Hezron, Daktari, asante sana for also just animating this session and running it very professionally. And to fellow members, asanteni sana for attending the session and staying with us until this late hour. Enjoy your holiday tomorrow. And for all the Muslims in the house, happy Eid al-Adha. Kwaherini sana. Have a good night.
All right. Thank you so much, Dr. Angeline. Thank you all for joining, our speakers, asanteni sana, our partners, our participants. Thank you so much for joining. So the communication on AGM, we're also going to share that again severally to make sure that you attend. That will be done via SMS and on email. So thank you so much for joining and creating time. Have a lovely evening. And for those who've not subscribed on the PPB portal, please do so. The CPD points are going to be shared by the CPD coordinator. Asanteni sana and have a good evening.
Bye, everyone.